Hey everyone, my name is Dr. Rick Barnett and I'm here with Zach Rhodes. We're going to do a little interview here about Zach's new book called Outgrowing Addiction. Zach is an author, a behavior specialist, podcast host. I've been on his podcast before, super fun, and a lifelong learner with a powerful perspective on addiction, etiology, development, and like I said, outgrowing addiction, the title of his book. I am a licensed psychologist doctorate, sorry about hitting the mic there, licensed psychologist doctorate. I'm a licensed alcohol and drug counselor and addiction specialist. I have a private practice in Stowe, Vermont, and I run a nonprofit called Carter, the Center for Addiction Recognition, Treatment, Education, and Recovery. So it brings me great pleasure to have read Zach and Stanton Peele's book, Outgrowing Addiction, with the subtitle, interestingly, With Common Sense Instead of Disease Therapy. So this discussion is going to be free-flowing, but before we dive right into it, I do want to ask Zach if I did the introduction correctly.
Yeah, we're good.
And if if there's anything you want to add, I'm really curious just out of the gate. Like, what was the inspiration for the book? How did it come to be? How long did it take you to write? Where did you gather all your information? It's a fantastic book. I've read through most of it and enjoyed it tremendously. But I really want to know the genesis of it. How did it come to be? And maybe throw in there a little bit more of your background.
Thank you. That was a good introduction.
Thanks.
Well, as you know, I had a really serious addiction to heroin for a long time in my life. I keep that timeline vague. Vermont's a small place, so when people are reading the book, I imagine them connecting dots and thinking, oh wait, at that time you were? But suffice it to say, it was a destructive point in my life. There were things that I had going for me, and I have pretty decent moral luck, given that I'm from a middle-class family, went to a good school, live in a nice area. Yet I was behaving in a way that was completely antithetical to some of what at least used to be my core values, in favor of drugs. And when I got over that addiction, it was like no way that anybody had ever told me that people overcome addictions. It seemed spontaneous, and it seemed very natural, and with no real intervention. I thought that was interesting, so I wanted to write a book about my own experience, and as I think a lot of people, at least intellectually sound people, do when they're writing a book about themselves, I realized that my story was, first of all, not unique. Second of all, it made me no expert just because I had an addiction. So I went in sort of stridently, like I understood the landscape, and I really didn't, at least at a population level. So given that I work with kids, as you mentioned, I'm a developmental specialist, and I work with a lot of families and kids on problems with behavior. Society would deem them, or schools sometimes deem them, behaviorally challenging. And so I started a podcast about that topic. And as I was, sorry, I'm sort of jumping around here, but okay. It all comes together in the end.
Yeah.
The podcast was originally filmed from my closet, or recorded from my closet. No one had to know that, but now you do. And it's funny, man.
That's how these things start, a garage, closet. Right?
That's right. And I figured that maybe 5 to 50 people, if I was lucky, would listen to it. At least my family. At least they pretend they would listen to it. And it turned out that the people I was talking to, the concepts I was starting to talk about, were interesting enough to enough people, for whatever reason, that it started being that I generated thousands of listeners to this thing. And once that happened, I got this inspiration that, well, maybe I can reach out to people I never would have thought to reach out to. So I reached out to best-selling authors thinking, well, maybe they would like it if I have a following and they'll come on the show. And people, by and large, said yes. I mean, you reach out to just about anybody and you have an intellectually honest pursuit, and they come on. So I was talking to people about developmental specialists, people who write books about that. And one person that came across was Stanton Peele. There were a few reasons I chose to call him. We can maybe talk about that later.
And Stanton is a psychologist.
Right. Stanton's a psychologist and author, pretty prolific author. I think he's written, but this book that I wrote with him, I think this is his 14th or 15th book or something like that about addiction. He had one book called Addiction Proof Your Child, and I thought that was pretty fascinating. So anyway, Dr. Stanton Peele I had on the show, we'd never met before, and he's used to, and this is another thing we'll talk about, he's used to his ideas getting sort of thrown off the table by a large majority of addiction experts, or at least people who claim to be addiction experts. And he was pleasantly surprised to hear that the things that I thought about child development and addiction, even though I didn't call myself an addiction expert by any means, really were in line with what he was saying. And I had a hard time understanding or believing that, but he would write me back. He was pretty good about emailing me back, or he'd send me an article and say, what do you think about this? And I didn't know what to make of that. I've never really had, it's called intellectual status. And so I was just enthralled. I thought it was the most amazing thing that I was keeping contact with this guy. Eventually it just became second nature to be writing back and forth and arguing with each other, teasing concepts apart. And he asked me one day, would you like to write a book with me? I thought, man, that'd be great. And so that was maybe about 3 years ago. And it took us about that long to figure out what we wanted to do. We'd started writing another book about recovery and the nature of recovery in the U.S. And then we stopped because we didn't think it was going to be sellable. Right. And I think we were probably right. And
it's interesting because right around the time that you and I connected over social media, it was probably within a year or so after you and Stanton decided to formalize the book.
That's probably right. I think maybe we're starting to work on it at that point. Yeah. And people should know, it's funny that you and I met on social media. It was like a little spat on social media. And so far as you and I are the kind of people who have spats, I think we're both friendly behind whatever concerns we bring. Anyway, a lot of things to talk about there, but I worked with him and wrote this book, and what we decided to do was, because he is, and this is in the subtitle, Common Sense Instead of Disease Therapy. We pulled from research that's fairly clear and robust that shows that the majority of people who use drugs or even become addicted to drugs overcome their destructive involvement with them. That doesn't mean that they become completely abstinent from them, but they overcome their involvements with them in some sort of destructive way over time, given that they live long enough. I think that's pretty fascinating, and a lot of people have a hard time swallowing that pill, so to speak. That was not a pun that I meant to, but
it's a fundamental framework for the entire book. Sure. The title itself, Outgrowing Addiction, the notion of spontaneous recovery, natural recovery, the fact that most people in society have consumed alcohol, tremendous amount of people have used nicotine, tremendous amount of people, even more so now, using cannabis, and then the numbers of people who've tried heroin, tried cocaine, even gone on to develop significant problems with these substances. Typically, by and large, something happens in their lives, in their minds, in their social lives. Something happens where it no longer holds its appeal anymore. The other stuff has taken its place, and that's really the premise of the book. And you go into great lengths and utilize really good research and all kinds of case examples, your own included, like you just shared with us, about how this phenomena is really it's not a phenomena, it happens most commonly. And the reverse is also true, that people who develop a problem with addiction and may seek treatment, formal treatment, in whatever form they may access treatment, that may not be the norm. I mean, it's the norm in terms of that's how people think of, well, I've got a problem, I need to get help. But the way people actually overcome it and get to the other side of addiction is typically not necessarily because, the medication I take for my addiction or the treatment program I went to for my addiction is like the thing that helped me. A lot of people just, like you said, kind of grow out of it. Is that about right? Yeah,
except that I would add maybe a through line that runs through everything is that we don't limit addiction to drugs. So we don't think there's anything inherent in drugs that makes an activity or an involvement or a relationship addictive.
Yep.
So that allowed me to open up my sphere of understanding and expertise, which is working with kids and their natural course of development, and Stanton to work with his that he's been writing about for a long time, which is working with adults and addiction, but also just development in general. And so we have now this wide spectrum where childhood problems look a hell of a lot like adult addiction problems, and the way that children grow out of their worst problems, non-drug or drug-related, is very similar to the way that adults tend to grow out of theirs. And so we can go wherever we want.
Yeah, I love that. That's fantastic. I mean, across the lifespan, I was just having a conversation with a patient in my office this morning talking about, you can't teach an old dog new tricks. And I was like, that's really just not true, that people in their 50s, their 60s and 70s come to new understandings of themselves and the world and still make profound changes in their lives across the lifespan. It's not just during childhood or just during adolescence or young adulthood, it's across the lifespan. So I just had that conversation this morning. So there's so many places to go with questions that I have, things that I took notes when I was reading the book about my likes and dislikes of what I found in there. But I do want to highlight, Zach had mentioned, you had mentioned the podcast, the Social Exchange podcast. And I noticed that in the book and on your show, for those people who watch this show and are interested in it, I would strongly encourage people to go to the podcast, because a lot of the people that you've interviewed or written about in your book, you also interviewed in your podcast. So I can think of Mark Lewis, for example, and a host of other folks that are mentioned in your book that are also on your show. And these are not just your average people. These are experts in the field who have written books, who run treatment programs, or write about the subject of addiction. They're deeply knowledgeable, and it's quite an accomplishment to have interviewed these people and to have access their knowledge and expertise to help you with this book.
I appreciate that plug, because I've gotten a lot of pushback. It's gentle pushback, but I think people are of the idea that if you don't believe addiction is a disease, then you must be on some other radical other end of your persuasion, where you think that addiction, if you have it, means there's something morally flawed about you and that you must change. And that leads, in fear of, some people fear, to punitive consequences. And that's absolutely not the case. So it's interesting, people wonder, well, who did you talk to who thinks addiction is not a disease? And the guests that I have on my show, the people I've interviewed in the book, the research, the list of bona fides is pretty long, and it's not abstract resources at all. So I appreciate that plug.
Yeah, well, I consider myself pretty firmly entrenched in at least the disease theory of addiction, and we've talked about this before. I think of it more of, and we've talked about it being more of a metaphor, using disease as a metaphor rather than getting so wedded to the concept of disease that it has sort of polarizes people into, like you said, this moral failure kind of thing where the only salvation is spiritual recovery from the disease, or medical salvation where the only recovery from the disease is because you're biologically flawed somehow and you need medications to help you. And so I appreciate both perspectives. I know that I understand the pushback. I can remember a conference that we attended recently where actually it was Carl Hart, I believe, who was one of the presenters, and he's mentioned in your book. He wrote a book called High Price, and he was very forthcoming about his drug use, current, and it not being a sin or something.
And he's the chair of psychology at Columbia University. So he's not just some guy using drugs talking at a conference.
Right, the chair of the psychology department at Columbia University, my alma mater, and he was up there very frankly speaking about his experience with drug use, past and current. And one of the participants, I believe he's Ed Baker. He does a show here. He believes that addiction is a disease, and he stood up and was sort of aghast at how Carl Hart could suggest that addiction was not a disease. And it was just interesting to hear that, even in a public sort of setting like that. So you get pushback from people sometimes when you have people on your show or you present a case for why addiction is not a disease and why the disease theory just doesn't hold up. Is that what you're saying?
Yeah, and if I were, let's say, running for office, if the game I was playing wasn't just to figure out ground truth, if the game I was playing was like to win a popularity contest, wouldn't have a razor's edge to stand on. Because the people who believe that addiction is a disease, and I've said we can get into this now about 1 million times, so maybe we should just dive in, but they are of the reasonable persuasion that calling it a disease is, whether or not it's correct, is something that's much more charitable to an individual than calling it a moral failure. Because now it's not the person's fault. I think that in the 21st century, we don't need that placeholder. I don't think we need to prop people up by saying that something is pathological. And so I don't think it's a disease, but I think that people who use drugs for various reasons and people who become addicted to them need to be treated with respect and humanity, and we need to have the decency to open up the kinds of models that'll help them progress and offer them their own autonomy and agency to do so and time to do so.
Yeah, I mean, one of the reasons why you and I get along so well, and you tweeted about this just the other day, that we agree about 99% of the time on just about everything, except there's maybe a 1% difference in subtlety in where we disagree. And we can get into that. But backing up a little bit, you know, one thing that I really liked at the beginning of the book was talking about just the word addiction itself. I personally happen to like the term addiction. I think it really does capture a lot. There are some people who would even stop right there and say, no, we shouldn't even call it addiction anymore. We should call it, I mean, we know we're changing our language, which I think is appropriate around, instead of calling it substance abuse or substance dependence, there's all kinds of issues around those terms, and that was updated in the recent manual that we mental health professionals use, the DSM. But addiction itself, as you mentioned in the book, it's used in the DSM around gambling addiction. I think it's actually in the book. It's gambling disorder.
Right, but they say gambling is addictive.
It's addictive.
It's the single thing that they say is addictive.
Yeah. So I personally like the term addiction. I think it does capture it at some point in someone's relationship to a drug or a behavior. Calling it an addiction, I think, is appropriate. I think the media likes to use addiction in more playful terms around, like, you know, a craving. There's a YouTube YouTube channel I like called Adrenaline Addiction, with guys jumping off cliffs and stuff like that. So addiction is a fun term. It's widely used, but I think it is appropriate when it comes to one's relationship, a problematic relationship with a substance or a behavior. Can you talk about just the term addiction in general and what your take on that is? Because I think some people really don't even like that term.
Completely understand why they wouldn't like it. I mean, it's the way that people use it often just does not, it does not account for a lot of the things that you might call it addiction, and it sort of singles out some addictions or some disorders or some disruptions in life that are prioritized higher than other disruptions. So we call addiction just a relationship that somebody forms with an activity, an involvement, a person, a drug, that they become wedded to such an extent that, I mean, because it offers them some sort of elation, some sort of pleasure, perhaps it offers them some relief, but they start to lean on that relationship, and as they do, and they don't desist, negative consequences ensue. So it's doing something despite negative consequences on one hand. On the other hand, there's an element of addiction where the involvement in this thing detracts from a person's ability to generate other positive experiences in their lives. So that's our basic definition. People can range from very severe addictions to very minor. Maybe it's not clear to them that that's what it is, but at least that's a definition that accounts for just about every domain that you could be talking about, every kind of relationship. And a lot of the pushback I get is, well, then we're all addicted. And to an extent, I mean, we've all probably experienced it, or at least most of us have probably experienced something like addiction sometime in our lives. That definition also opens it up to be able to talk about things like childhood problems, rather than talking about just drugs or adult problems with alcohol or gambling or things like that.
Yeah, I mean, I think the term addiction, if you were to look at the etymology of it, I mean, I'm curious to see what you think about this. I think the etymology is to be a slave to something, to be dictated to by some other thing. So you are addicted, you're being a slave to or dictated to by something, by a substance, by a behavior. So it's basically enslaving you, it's imprisoning you. Do you agree with that? Like, calling addiction, do you think problematic drug use, alcohol use, or gambling, other types of behaviors, is enslaving in some way?
Well, I agree that it is, to the extent that a person can enslave themselves and then move out of that. You know, I believe in a sort of libertarian free will, that people can reroute, form new habits, and get out of whatever involvements. But certainly I believe, if we could talk in just plain talk now, I mean, I believe that people can get into something, an involvement, in such a way that they feel enslaved to it. They feel like they're a slave to this thing. if I could pull it back to my work with kids, people will ask a lot why a child exhibits this behavior, which is usually behavior deemed challenging or wrong by teachers, peers, society. And they'll say, why is this kid doing this? Even though it's really clear that at the end of the day, they don't seem to want to be doing this. Why behave this way again and again and again, no matter what the consequences, no matter how negative it seems? And the answer tends to be that kids behave that way when they don't have an attractive alternative. Mm-hmm. Human beings behave in ways that are negative to them in the long term because they feel like they have no attractive alternative. For various reasons, when we don't feel like we have the skills or resources needed to behave in ways that are, act in our own best interest in the medium to long term, we look for local pleasures. And that, at least if you can't get a local pleasure, you can get some sort of consistency or control. So a lot of times kids are behaving in ways that are deemed challenging, even though they would not like the consequences, because the consequences are predictable. There's not another array of choices they feel like they could make.
Right.
Of course, kids grow up, and it's just not true. There are other choices they could make. The rub is that they need to generate those on their own. They need to experience an array of choices that they could make other than the one that's so destructive to them, and they need to live so that they can believe that that's true, and there are other choices they can make. And I think that's similar, if not exactly the same, in adults and anyone who's using drugs.
Yeah. It brings up the point around what you describe, I believe, in the book, and something else that you work on aside from working in the school system with kids is this life process model. Is that correct? So the life process model, if you could talk about that a little bit, it sounds like that's what it's based on. It's based on working with people around problematic behaviors, use of substances, to help sort of see where they're at with their relationship to these substances and see if there's room for growth or change in finding other things or meaning or purpose in their lives. Can you talk about that a little bit?
Yeah, well, so a disease model, I think by and large, and I think I'm doing it justice, but you can correct me if you think there's a more charitable way to describe this. The disease model would say that there's focus that needs to be placed on a drug, on the object of a person's addiction. And that, I think, is true to an extent, but I think that the disease model places so much focus on that and so much on pathology that there's a person being, like you said earlier, enslaved to this process or enslaved to this drug, that it requires some sort of an intervention that is visited upon them. Alternatively, in our program, the Life Process Program, and the model that we use, we call it the developmental model, but the program is called the Life Process Program. People come to us for help with addictions or for themselves, trying to ameliorate their problems, or to get help with addiction problems for their family member or child. And we run them through a set of questions, and we ask them, hey, what do you think your skills are, your best skills? What kind of skills do you think you lack? What kind of community involvement do you have? What are your values? What are some values you hold closest to you? Given your drug use and alcohol use or whatever other involvement you're worried about, what does that say is valuable to you? At that point, people can usually tell a difference between what they value in the short term when it comes to their relationship with a drug or an activity, and what they value in the long term. So long term, it's usually things like family or community or sense of adventure or things like that people generally value and get a lot out of. The things that they value when you ask them, considering your drug use, what does it show that you value? Most people will say, well, interesting, pleasure in the short term. And we sort of talk people into their own state of dissonance because they, by virtue of starting the program, they're already telling us there's some weird dissonance going on, and I'm trying to figure out what is going on. Right. So we ask them questions until they tell us what it is that seems to be the problem. The way out of that, of course, is trying to enhance skills, enhance resources, enhance family involvement, social involvement, community commitment, values, resources, and mature. And that means for adults, maturing means a similar thing to when kids mature chronologically, and they have to get a hold on all of those things. And so we, as clinicians, give the help for them to be able to think through how they might achieve them, rather than saying, oh, you're addicted, here's what you need to do.
Yeah. No, so there are examples of the Life Process program, walking people through in the book. So if people are interested in sort of seeing how that actually plays out, great examples in the book. We have a few minutes left. I'm surprised how quickly that has gone by. I thought we had much more time. So I do want to bring up one specific quote. I came up with several quotes from your book that I wanted to go over. You know, one thing before I give the quote is a very often quoted statement from Johann Hari, who you've had on your show a couple of times. He wrote a book called Lost Connections and also Chasing the Scream, about addiction and depression. I mean, these books are about, one is about addiction, one's about depression, mental health. And one of his famous quotes is that the opposite of addiction is not sobriety or abstinence. The opposite of addiction is connection. And we talk about the concept of addiction, and we talk about it in terms of enslavement. One of the things I like to add to that, it may be that the opposite of addiction is connection. It may also be that the opposite of addiction is freedom. Freedom to live one's life the way one wants to live one's life. Freedom to use drugs, to not use drugs, to have meaningful relationships and connections. And one of the quotes in your books you were talking about is actually the chapter on 12 steps. At the end, you said, overarching everything in America is the loss of intimacy and community, a lack of connection to the world around us, and often a loss of connection to our own selves. This disconnect to our own true selves is a central part of seeing ourselves and our children as diseased beings. Can you talk about that quote? Do you remember that quote from the book?
Yeah. There are a lot of things competing for our attention all at once. And there's an idea that we need to do things in a time-urgent kind of a way. And so this array of local pleasures that we all feel all the time, be it technology, be it drugs, well, there's a sense that we are not connected in the form of community, in the form of close family, and we're losing some of those things in favor of some of the ways that we get local pleasure. And it makes it worse, I believe, the sort of interventions that we place on that. So a kid, if they're seem to be losing their way in some sense, you know, I look at that when I'm working in a school. I look at a kid who seems to not be able to connect all of the dots in terms of being a decent student in the school. I don't see that as a completely hopeless cause. And, you know, I would not even intervene with that kid more than to talk with that person and figure out what makes them tick. How is it that you think would be best for you to orient yourself in the world, contextualize yourself in a community? I think that if I were to say, you're not behaving in a way that you're supposed to behave, so let me give you this label, this diagnostic label, that's not necessarily a bad thing. But it can definitely confine a person's options moving forward. And that's what I think that Americans have favored a model of intervention for people because we feel like we need one, and reasonably so, because a lot of people are dying of drug deaths more recently than ever before. And so we feel like we need an intervention. My argument is that we want an intervention that does more good than it does harm. And lastly, I think that our styles of intervention, broadly, nationally, tend to be doing more harm in the long run than good. And that's what I mean by that.
Well, I think it's fantastic material. The book is fantastic in general just because it does present such a cogent and well-researched and very accessible idea of addiction and overcoming addiction in the most broad and open-minded kind of way, rather than being pigeonholed into a specific category, like you said, label, disease, medication, that kind of thing. It's like, let's think more broadly about that, and here are all the reasons why. So it's a very open-minded, broad-minded, thorough, it's an excellent book. I hope people decide to pick it up and read it. It's got some great endorsements. I couldn't believe all the endorsements you had in the beginning of the book from some really fantastic people. So thank you so much for doing this interview, for allowing me to pick your brain a little bit more about how the book came to be and the concepts behind it, and like I said, there's just so much more. I had a lot more questions to ask and places to go, and hopefully we can do this again and continue to dig deep into some of these topics. I know there's some more controversial stuff that we can dig into at some point in the future, and I just really appreciate you taking the time.
Thank you very much. And that's actually, I should say to close, that's what I like about my relationship with you, is that, and this is what I was saying on social media the other day, I believe that everyone needs an intellectual arch nemesis. And that's a silly way, it's tongue in cheek, but I believe that you and I are like that. So I know what's going to happen here. You and I, you've read the book now, you and I are talking about, you threw me a few softballs. It's like, this sounds nice, explain it a little bit. And I really appreciate that, because I need to do enough advertising that people will understand to buy the book. But I know that in the coming months or so that we will, you'll have plenty to quibble about. And so we agree on so many things, and I believe that your ways of getting to truth intellectually are sound and honest, and you're a very smart guy. I think the same thing of myself, whether that's true or not.
Yes.
There are things that you and I both believe that cannot possibly be compatible. About addiction, they can't possibly be compatible. But what I like is that we just remain in discussion and dialogue like this. A lot of people didn't want to talk to me because they figured that my worldview was too far apart from theirs, that they wouldn't even know where to start in an interview. I think this is a pretty damn good start, so
yeah,
thank you, Rick.
Let's keep the conversation going. Thank you.